thank you everyone for coming. I know everyone is, we're all going through uncharted waters these days. It sounds like a lot of people have been creating contingency plans already. So that's really great. And I'm sure we'll have a lot to share. So thank you everyone again for coming. And today we're going to hear from Dr. MarkAlain Dery from WHIV in New Orleans. He's an infectious disease specialist, and he's going to start us off today. And then we'll also hear from Kate Ingram, who is from, I have to look at my notes, KPTZ in Port Townsend, and Celeste Carey. Another special thank you to her because she started the idea for this meeting. She had the foresight to think about it, and so we're really grateful for that. And she's from KBOO in Portland. And Keith Withrees is also considering talking. He's more concerned about other emergencies, but being organized in general is good for everyone, I'm sure. So he'll decide if he wants to add in.
Before we get started, can we just ask everyone to please mute their mics unless they're talking, please? Thank you.
Oh, yes.
Or you can mute and call on people, can't you?
Yeah. Everyone has a little mute button on the bottom left-hand corner that we'll take turns talking, especially when someone's doing a little presentation. And then afterwards, we'll unmute for questions after each talk. So I think with that, with no further ado, Dr. Dery, please take it away. Thank you.
Thank you so much. Ms. Stephanie, can you remind me how long was I supposed to talk for? Just so that I can keep track of the time.
I believe we talked, you were going to do from 20 minutes to a half an hour, depending on how we felt.
Okay, good. I'm glad I asked you.
We have this session set for 90 minutes, so we can have extra time if we need it. So.
Okay, all right. So I have a slide deck that I prepared. It's a little bit longer than that, but what I'll do is I'll just skip through slides as I kind of watch through the time. How can I share? It would be this. I think I hit share, right? There we go. And are y'all able to see that?
I can see it.
Yep, looks good.
Yes.
Super. So I'm a professor of medicine. I see it. I'm a professor of medicine at Tulane University. I specialize in infectious diseases. I'm Chief Innovation Officer at the largest Medicaid providing clinic in the state of Louisiana. So if you guys don't mind my somewhat formal sort of manner of presenting information, I appreciate it. I also founded a radio station in New Orleans, which was a whole other thing. So I appreciate being able to come here. I got to actually name the station WHIV. Although I am an HIV doctor, the radio station isn't all about HIV. There are some folks that do have HIV that talk about it regularly on WHIV. If I could have named the radio station W Social Justice Radio, I would have, but I couldn't. And so I used the letters H and I&V as a surrogate for all things human rights and social justice. But that's what the function of our radio station is about, and we focus on social, economic, environmental, and racial justice. Anyway, that's the radio station, and wanted to start kind of quickly just to help people understand what SARS-CoV, MERS, and then SARS-CoV-2 are essentially. And those are the names of the viruses that we have. Now, these are all coronaviruses, and what's unique about these coronaviruses is that if you would have asked people what we would have seen happen in the form of an epidemic, would it have been the avian influenza? Would it have been a coronavirus? I think that most folks would have predicted a coronavirus just because it really hits the epidemic sweet spot, if you will, especially this particular virus does. In that, so wait, and I'll explain that in a second. But what you see here is that we've had 3 coronavirus epidemics already this century. Number one was SARS-CoV, which was the virus that was responsible for the SARS epidemic in 2002 and 2003. MERS is the Middle Eastern Respiratory Syndrome, which we saw again in the Arabian Peninsula. It's still there and has quite a tremendous mortality rate of almost 50%. And then now what we're dealing with is the SARS-CoV-2 virus, which is leading to a disease process called COVID-19. And I just refer to C19 at this point. That's how I document. I've probably seen anywhere between 300 to 400 patients I've evaluated for C19 over the course of the last week. I've tested quite a number, and right now we're just mostly using telemedicine, using things like Zoom or whatever way we can kind of get into patients' houses so that they don't come out of the house and potentially risk infecting other individuals. So these slides are basically just showing where the various coronaviruses are coming from. The one that we're dealing with right now is the SARS-CoV-2. Again, and what makes this virus particularly unique and why we would have predicted this one, and when I talk about that epidemic sweet spot, is that just like the influenza virus of 1918, this one is particularly transmissible and also does not cause a high mortality rate. Now, that's easy for me to say if I get SARS-CoV-2, which I completely expect to be infected with it at some point, just because of the fact that I'm, that's all I'm doing right now. But it's easy for me to say that, but there are people who are going to potentially die from this, and we have seen mortality happen. And I think what we're just seeing is the tip of the iceberg. But this virus allows for its host to transmit the virus asymptomatically before there's an illness, during the illness, and then after the illness as well. And that's what makes this one particularly unique. The reason why the virus is so problematic, and I think I get to it here. Now, the reason why the virus is so particularly problematic is that this virus jumped directly from bats into the human population. There was probably an intermediate host that could have been, most people are looking now at the pangolin as a potential intermediate host. So essentially, about 10% of all circulating cold viruses are basically coronaviruses. And so if I'm 51 years old, and if I get a cold virus every year, it stands to reason that I've probably had over 5 decades, 5 coronaviruses as common colds. What's unique about this one is that this jumped directly from bats into human beings. So the previous coronaviruses that I've had that caused common colds, those were acclimated to human immune systems. Whereas this virus, there is no immunity. Nobody has immunity to this particular virus. And this is what makes it so unique, and this is why we're seeing these mortality rates right now that the WHO is guesstimating at about 3.4%, but we won't really know that mortality rate until surveillance studies are going to be done after the disease process passes, and we do antibody studies to get a real good idea of what the actual denominator or how many people actually really got the disease, so that we can figure out what the actual mortality rate essentially is. So what this slide is essentially showing is that we have a tremendous
Dr. Dery,
yes.
Someone mentioned that the slides aren't changing yet, and I don't see a change yet on mine.
Oh, really?
Yeah.
Oh, my goodness.
Yes.
Yeah, I don't see it either.
Correct.
Oh, now it is.
There we go.
They are.
I think this happened before. I think it doesn't. Yeah. Okay. So I'm so sorry, guys. So these are the slides that I've been showing you. So all right. So what we're seeing here is that the epidemic is just unbelievably taking off right now. You could see that I first remember reading about this in late December, and I know that because I remember I was in Mendocino with my wife when we were vacationing, and I just kept bugging her about these stories that I was reading in China, and she wanted to go for hikes, and I was very obsessed with this story, and and I remember driving from here to there, and I was just chatting with her. I'm like, "Do you think?" and and she was like, "Don't be ridiculous," and you could see now that this is become an unbelievable disease process, and of course it's become a pandemic. I'm going to show you some really interesting slides at the end in terms of what the media situation has been as well. Here you can see the disease process, and you can see Italy is just really taking off. And I got a better slide for that. Here you can see the various countries, and let's just focus on where is China. I'm used to this being a little bigger. Let me see. Can you see that expand like that? When I expanded, do you guys see the expansion?
Yep.
Yeah.
Yes. It's working now.
Super.
And
All
you're
right.
also able to expand it with your fingers on your phone too, after you expand it.
Okay, super. So what I want to highlight here is these are the number of the trajectory of COVID-19, C-19 in various countries, and you can see here's Italy, which is really taking the grunt of it, and you know the hospital systems and in Italy are completely overwhelmed at this point, and are cratering. And now that they are limiting ventilators for people only under 80 years old. And what I want to highlight is that the U.S. is on a very similar trajectory that Italy is. And I also want to highlight South Korea as well. And South Korea has done this amazing job because they have been testing everybody. They do about 20,000 tests a day, compared to up until the beginning of this week, we'd only done like 11,000 or 12,000 tests. Over the course of the last couple of days, we've increased it to 60,000 tests. But you can see that South Korea was able to catch, because they were doing so many tests, they were able to catch their positives, and they were able to institute social isolation and quarantining. And you can see that curve leveling off. You can see Italy didn't do it, and hopefully the U.S. and with what we're seeing now with the attention on this, hopefully we'll start to see that the U.S. starts to and people start to do this as well. Let me skip through a couple of these slides as well. We have a C-19 in every state in the country. This is a good slide to show, just to kind of, as you guys have probably heard already, that those that are mostly at risk are those that are over the age of 60. I did see some headlines this morning, I didn't get a chance to read them, in which they're starting to say that the American experience of the C-19 virus has been that younger people are a little bit more at risk than has previously been thought. But again, I didn't get a chance to click on that. But what we do see is, at least from the Chinese experience, that people who are over the age of 60 are mostly at risk. When you look at those people with cardiovascular, those people with comorbidities, and those that and the folks that are dying are those people with cardiovascular disease, diabetes, those people with chronic respiratory disease, high blood pressure, cancer, and a couple other folks that are at risk for infection include those people that are smokers, as well as those that are obese. Another interesting fact here to talk about is what's called the reproductive number. Some people may refer to it as the rho or the R0. And the reason why it's important to understand is every virus has a number that allows you to kind of determine how many people can that virus spread to. And this and so when you have an R0, the R0 for the COVID virus is about 2.4. I think it'll show on the next slide, 2.6. What you want any virus to have is an R0 of less than 1, because essentially what this is showing you is that one person can transmit to 2 people, and then those people transmit to 2 people, and you can see all the way down the line. And so here you see the various, you can see the R0s in the, this is a really interesting slide because it'll show you how virulent on this scale here a particular virus is, and here it'll tell you what the R0 is. So measles is without question the most infectious disease that we see. Its R0 is pretty aggressive, with an R0 here you can see of about 9 or so. That's why when one unvaccinated child goes to Disneyland, then you have a whole outbreak at Disneyland just because of that that child who's unvaccinated, because the measles is so easily transmitted. It's transmitted through airborne transmission. But here you can see COVID right now kind of sits in this area right here. where it's R naught kind of sits somewhere between the 95th percentile. Here it sits between 1.5 and maybe 3 point something. So 1.5 and 3.5 essentially is the R naught. And fortunately, like I said, the mortality rate is low compared to something like Ebola or bird flu, and like I said, MERS as well. And thankfully, these viruses here have very low R naughts, and which is great. And that's one of the themes in infectious disease, especially in epidemics. Ideally, when a virus has a very high mortality rate, its R naught is low or its infectivity is low. And then you can see here when viruses have very high infectivities, their mortalities are low. What we never want to see is a virus that has a high R naught and then high infectivity and then a high mortality. And I don't know if you guys can see my cursor, but this is where we never want to see a virus be. The reason why this is particularly problematic is that this is transmitted through either respiratory droplets, but now there's some new research that came out in the last couple of days that is suggesting that the SARS-CoV-2 virus or COVID-9 or C19 may actually be transmitted through airborne, which means that the particles are smaller than the actual droplets that we had talked about. This is looking at Louisiana, and I've been making these presentations for Louisiana. But one of the things I do want to highlight is that you could see that for those people, these coronavirus cases in Louisiana, you can see that, as I was saying, we're seeing younger people getting this. So it may not necessarily be limited to just older people as we had originally thought. Now, transmission, as we had talked about earlier, was directly from bats to some sort of intermediate mammal directly into humans. But now when we go from person to person, shaking hands, so please don't shake hands, do elbow bumps or just do, like I say, a phantom elbow bump at this point, by respiratory droplets. And again, this is going to probably be updated to include airborne because we now recognize that the particles can be aerosolized. And then, of course, of touching contaminated objects and then touching yourself as well. And my phone just lit up to say that the Saints head coach, Sean Payton, tells ESPN that he's tested positive for coronavirus. So this is what we're going to be seeing is we're going to be seeing a lot of folks, coach, the Saints are the football team for New Orleans. And it's, pretty stunning to see as I'm talking about this, that the head coach for the Saints now is positive for coronavirus. It's really touching every person in our society. The clinical syndrome, real quickly, the incubation period sits anywhere between 5 days to roughly 14 days. And that's kind of where you get that number of 14 days. Most people, about 99% of people have expressed their clinical syndrome by at least 14 days. The symptoms of COVID-19 include shortness of breath, cough, and fever. But I'll tell you from clinical experience, people are having, and let me just comment about the fevers real quick. These are really, really high fevers. Fevers that are 102.8, 103.4 are fevers that I'm hearing about. The coughing is a dry cough, and the shortness of breath is pretty profound as well. But I've seen people have some subtle cases of shortness of breath as well. But these are the three that we look for. The other things that I look for too are headaches, pharyngitis, sore throat, as well as fatigue. So those are the 6 things that I usually ask about when we determine if somebody should be tested for COVID. As I mentioned to you, that a majority of these illnesses or infections are mild, but we do need to recognize that some are severe, and then thankfully a minority are critical that are going to require hospitalization. And we're going to get to that in a second when we talk about something called flattening the curve, because I think it's important for us to understand that. You could see that the bulk of folks recover, and again, only a minority of people die. And here they've got a mortality rate of 3.7, but that number is going to fluctuate pretty well. And then lastly, just say that men are more at risk for death than women. Women have some protective effect, but men are more likely to pass as a result of that. In terms of public health measures, super important. Alcohol, hand sanitizers need to have 60 to 90% alcohol content. Any of these, natural hand sanitizers or whatever, I at this point, I wouldn't even bother with those. 60 to 90% alcohol content. My mother-in-law came to visit 2 weekends ago. She went straight to the pharmacy, bought a bottle of isopropyl alcohol. She bought like a bunch of these sorts of bottles and just filled up the isopropyl alcohol into spray bottles. And then that's what we were just using all weekend long. And my hands got pretty dry, but to be honest with you, that's with the fact that we can't get hand sanitizer at this point, that's not a bad idea. So that may be something you guys may want to consider as well. Frequent hand washing is another important thing to consider as well. You want to be doing that for 20 seconds. Cover your mouth and nose when you sneeze and cough, and do it in your elbow. And of course, avoid close contact. Now, I'd mentioned something called flattening the curve, and I'm sure you guys are probably hearing about this a lot. And this whole notion of flattening the curve is if you see this as being the capacity of the health system's healthcare capacity, what's happening in Italy is Italy had this sudden increase in cases that went up like that, right? And it completely cratered their healthcare system. So what we're trying to do is we're trying to spread out the time that that this virus is going to be circulating in our environment by very slowly spreading out the disease process, so that this way it does not overwhelm the healthcare system. This way healthcare workers are going to be safe. This way ICU beds will be available as well as ventilators. Again, this is called flattening the curve. I'm sure you guys have seen or heard about it a lot. Again, we don't want a sudden spike of cases. Even though the disease process would burn itself faster if we did this, the reason why we're doing this social isolation and quarantining is that we're trying to decrease the rate of spread through society, so that this way it never surpasses that healthcare system capacity that you see there. And the way that you do that is through social distancing. And so, remain at a congregate settings. I'm sure in your communities things are happening that have never happened. We're seeing things that we've never seen in a lifetime. But, some of the major festivals, you guys know in New Orleans, we have festivals. I'm sure a majority of you guys have all come to those. Jazz Fest and French Quarter Fest have all been canceled or at least postponed for obvious reasons. And our mayor's been doing an amazing job slowly kind of closing the city down, kind of much like what we're seeing happen in California. One of the things that the mayor did was that she shut down the big St. Patrick's Day parade that we have every year. In fact, I have an annual HIV conference that we do in correlation with the St. Patrick's Day parade. I canceled it, then the mayor canceled her parade, or the St. Patrick's Day parade, but you could see people still were out and about in the streets. They did not get the message. Then the next night, police came through and just literally had to drive through streets and break people up. And now you can see here on March 17th, on actual St. Patrick's Day, which usually New Orleans would be packed. People would be doing what they do on Bourbon Street, which, by the way, just as a quick comment, if you ever come to New Orleans, you can skip Bourbon Street. There, I said it, okay? But here, this place would be packed as well. And you can see people are now just starting to get the idea of what's happening. It's interesting to look at the media response. HIV that has been around since the early 80s. At this point, only almost 70 million mentions in media. SARS, 66.3, MERS, 33.1, Ebola. But look at the coronavirus. And I'm sure when you guys look at your own news feeds on your own devices or whatever, it's all coronavirus all the time. And that's largely because we've never seen anything like this in our lifetime. The last time something like this happened was in 1918. And we have been warned. I myself have done that warning. Just again, I'm a student of infectious diseases history, and telling people that I thought when H5N1, I thought with SARS, I even thought the H1N1 was making a comeback, but none of those really, they didn't hit that spot, right? Some of those viruses were a little too virulent. They caused a little too much, the virus was killing its host too early, right? So from a virus's perspective, it doesn't want to kill its host, right? It wants its host to live so that it can continue to transmit to other hosts. But this virus really, it's in that perfect position from the perspective of virus, obviously not from the perspective of human society, but from the perspective of the virus, it's really, it's pretty well infective with a very low mortality rate. And you can see that the mentions in media reflect people who are, quite fascinated, and for good reason, about the coronavirus, because there is real anxiety and real fear that's out there. And you can see here what we're seeing now mostly is just there's a significant amount of racism as a result, in xenophobia. And so my wife and I came up with this word to try to explain kind of like, for example, the President Trump, who keeps using this word Chinese virus, I find to be incredibly offensive. And so we came up with this term about 2 weeks ago, and we referred to it as pathogeoxynophobia. And the idea being that these are, folks that become afraid of a pathogen when it originates from a different country or different culture than their own. And so again, pathogeoxynophobia was a term that my wife and I, because we were talking about it a lot, and we just didn't have a word, so we just kind of came up with a word to describe, kind of like what the president is talking about when he refers to the virus as being the Chinese virus. The WHO was very careful to not refer to this. I don't know if you guys remember, it used to be referred to as the Wuhan virus. And about a month ago, they stopped referring to it as a Wuhan virus. And they actually then gave it the name SARS-CoV-2 and then renamed the disease process COVID. And COVID essentially stands for coronavirus disease. So the CO in corona, the VI in virus, the D disease, and then in 2019, because the first case was identified in December 31st of 2019. So again, here, as you can see, as COVID-19 spreads globally, xenophobia and racism against Asians and Asian Americans is happening. Asians across the world are being attacked at increasing rates, and racist and xenophobia sentiments are spreading by social and traditional media, and Asian-owned businesses are being economically impacted. So
Mark?
Yes.
This is Ursula. I want to make a request. We really want to know how you as an expert are handling this at your station. And I want you to make sure you give yourself time to say what.
Yeah, I got, there it is. I'm right there. I'm right there. There, in fact, there it is. There's the next slide. So here's where we are, and here's WHIV, and here's what we're doing. So what's going to happen, I anticipate, is that there's going to be, when they start to kind of close society down, they're going to start talking about businesses that are going to be essential services like supermarkets, banks, pharmacies, possibly dry cleaners, sanitation, that sort of stuff. So because media will be considered an essential service, we are trying to, and a lot of what we do is what we consider to be essential services itself. So how we're going to start changing the station, and this is going to start today or tomorrow, is that at any one time we're going to only have one person at the station at the time. We're going to be, throughout the hour or 2 hours that people have their shows, they're going to be reading essential messaging services. So we're going to have kind of messages, daily messages, or messages there for the week that they're going to be required to read kind of in there during the course of their show. And then we've developed this procedure to wipe down the booth and use hand sanitizers. And here it is. Make sure we're telling people, if they're coming to the station, make sure to wash their hands. We recognize that wipes are in short supply, so we have the disinfectant spray. We have several windscreens for mics. Those are actually gone. So what people are doing now, they're just bringing in clean socks. And we're telling people that if they have a clean sock, they can put a clean sock over the microphone as well. And of course, we're telling people not to touch the board with any liquids whatsoever. and we're just telling people just to wipe everything down after they're done. And again, like we said, the only time that there's going to be 2 people at the station at any one time is going to be when one person is coming in and another person leaves. Now that's easy for us because our station is, we're an LP FM radio station, so we're volunteer, 100% volunteer. So we don't have a station manager. We don't have, we have a record company that lives in our station, and but they are no longer going to be there anymore. So all those people are out and they're doing their businesses from home. And so this is kind of how we're going to start. And we feel that this is probably the best way moving forward for us to be able to not only to keep the station on air, but to also protect the DJs and the show host while they're there. So with that, I just wanted to say thank you guys very much for giving me the opportunity to talk about this.
Does anybody have questions?
Any other questions? I can start with I just noticed on the chat here that James Costello mentions that there are recipes for homemade hand sanitizer that include aloe that might help with dryness. I don't know if you've heard of that, Dr. Dery.
Yeah, I mean, I've been seeing the homemade hand sanitizers, and I have a feeling that people will be going to that. Again, I just would make sure that there's 60 to 90% alcohol content in there. Otherwise, it's not going to be effective in dismantling the virus.
Okay. Also, I had a comment. What do you make of the Trump administration rejection of the WHO test?
So that is hugely problematic, and I skipped over it a bit here. And in fact, there it is right there. It's incredibly problematic. In fact, I was on another radio program this morning, and one of the things that I had mentioned as I was being interviewed was that it's going to be very interesting in retrospect. I would love to have an investigative journalist look back after all this is done to see where that decision was made, because the WHO, so what happened with the testing was Germany had developed a very, very, very good test. They distributed it widely throughout the world. And the U.S. was the only entity that refused to take that test, and instead that test was they opted to try to give it to a private entity here in the U.S. And then when it was go time, the test completely failed, and somebody made that decision to do that, and it would be interesting to see who that is. I think that there probably should be repercussions of some sort, because instead of doing this, we went there. And we are starting to see these cases starting to accumulate, which is obviously, as I said, is tremendously problematic. So yeah, not doing and not taking the WHO test was incredibly problematic. We're still running out of supplies right now. This morning we had to count in my clinic system, we had to count out how many swabs we had just to do the test. And we are looking at our list of people that need to be tested, and we're having to triage only those people with the most severe symptoms are the ones that are being tested. So it's really quite scary, the situation that we have here.
It's Otis, and I just looked at Amazon. There's no alcohol available.
Yeah, isopropyl alcohol is just not available.
Yeah, isopropyl alcohol, there is none. Not at Amazon.
This is Katia. Can I ask a question? I'm sorry. I just want to say, if alcohol is not available, I have heard of people talking about using like hydrogen peroxide or witch hazel. Are either of those effective?
I don't know. And I bet you we're going to probably start hearing more about that because if isopropyl alcohol is no longer available, I would imagine that we'll probably start seeing other, we'll get some guidance from some entity. The WHO has a list, and if you just Google WHO, COVID-19, and disinfectants, you'll see there's a couple different lists. I think the CDC may have a list as well of disinfectants that the CDC has stated would be particularly, that is effective for the C19 virus.
We have a question here. We at WRFG, Joan Baptist Station Manager wants to ask a question.
You stated that it can be spread prior to people feeling sick, while they're sick, and after. On the news I heard today that they were saying you don't have to wear a mask if you're not showing symptoms. Can you speak to that? I mean, is that really, I mean, not that everybody's going to wear masks and everything, but it seems like, is that misinformation or is that accurate? If it's spread prior to even showing symptoms.
Right. So it does spread. You know, let's say you were infected at day 0, and let's say you start showing symptoms at day 10. Let's say your incubation period was 10 days. Well, you may have had 7, 8, or 9 days where you were transmitting virus completely asymptomatically. And then when you're sick, you will continue to transmit virus. And again, after you're sick, there's a lot of evidence to suggest that you're still transmitting virus. So the idea of wearing a mask is difficult. It doesn't make any sense to wear a mask. And the reason is at least for people who are not sick. If you're sick, yes, it makes sense to wear masks. If you're symptomatic, it makes sense to wear masks. But if you're not sick, there just aren't enough masks to go around the world for all of us to be masking ourselves. That's just not feasible. But if you are not sick, you know, the idea of wearing a mask doesn't make sense either. And I'll explain why. Is that the virus itself is 0.1 micron, and to give it context, a human hair is 75 microns, right? So when you look at the stitching of the mask, right, that virus is so small, it's like trying to use a chain link fence to hold out flooding waters, right? So wearing a mask, if you're healthy, doesn't make sense. If you're wearing a mask because you're ill, that makes a little bit of sense as well, and that really came out of the SARS epidemic that happened in Asia in 2002 and 2003, and that was largely because in the Asian culture they're so courteous that wearing a mask was a sign of, I don't want to spread my germs or my virus to you, and so that's where the masking came from. It was really protecting somebody who was sick from transmitting virus to somebody else. It was never intended to be used for somebody that was healthy to prevent virus that was coming to them. And we talked about that stitching, right, being so big, right? The other thing too is that virus, that mask bunches up on the sides a lot too. And so, you know, the virus is able to get in through the sides as well. So anyway, so I hope that answered your question.
So can I mention that there's a lot of chat going on in conversation and maybe questions there. Are we monitoring those as well so we can address those and have not redundant questions?
People who, just a reminder to check your mute button if you have to talk to someone in your room.
Stephanie, are you going to read the questions that are in the chat?
Yeah, I see there's a couple more here. John asks, is the best action to moisturize after using alcohol, sanitizer, or washing hands?
What? I'm sorry, what was the question?
I think he's asking if you use alcohol sanitizer and you use moisturizer afterwards, does that take the effectiveness?
That's probably fine. That's probably fine.
Okay.
Can I just also say a couple things that I've been seeing too? Let me just kind of kill a couple myths. Let's see. Going into saunas does not kill the virus. Drinking a lot of water does not kill the virus. Holding your breath for 10 seconds in the morning when you wake up to see if you've got the COVID-19 that's not an accurate diagnosis. And I forget, I've been seeing so much. Obviously this virus is completely biological. There's no evidence that was created in a laboratory or whatever. That's crazy talk. And that sort of stuff needs to be stopped immediately, that sort of talk. Are there any more questions?
I have one more here on the chat from Mauro Oliveira, asked about what about military full face rubber masks with filters? I think it's called the Israeli mask, he says.
Sure. I don't know. If you want to walk around society like that, sure. I mean, I bet you'll probably be safe, I'm sure.
Okay, thank you. Anyone else have a question about health in general or about radio station protocol that they want to talk about?
This is Keith at KXCJLP, and I am wondering about if there's any difference clinically in terms of a viricide between ethyl alcohol, drinkable alcohol that is of sufficient concentration, and isopropyl alcohol. We're out in the country and we might have folks that will distill alcohol, which we usually use for drinking, but we could use to wipe things down.
So I couldn't say with 100% accuracy whether or not that may be helpful. This is going to go on for a long time. We're going to be socially isolated. Our lives are going to be disrupted pretty significantly for a while, and this is going to be the new norm. We haven't even hit the stride. We haven't even hit our new norm yet, but we're certainly on path to getting to where our new norm is going to be, and it'll take some time for us to get through this, again, because we're trying to flatten the curve, as I said. So if in a pinch, and if you have nothing else, you sure? I mean, it's not, it's not anything that potentially could particularly hurt you, I think. But I don't, of course, isopropyl alcohol is ideally the best.
Can I ask another question? That aside from the social cautions we should take or precautions we should take, what is it? Anything coming down the pike from the FCC around what stations to be prepared for in terms of a EAS alert or something to that effect if it becomes a national shutdown, or stations staying on air if they're 24/7, or shortening their hours to eliminate some of the social interactivity between those who are on the air? Have anything come down from the FCC?
I don't know. I haven't heard anything, and I bet you there's probably other people in this group that could answer that question a lot better than I can.
We have another question from WPVM. Any ballpark estimate for how long we can expect to be dealing with COVID-19?
I mean, no, but I mean, I can throw out some 3 to 6 months are the numbers that I've been thinking about. I just read, I think it was either Time, it was a Time magazine headline that came on my phone as I was just grabbing my lunch and coming up here, that was guesstimating 12 months. I think that's a little bit on the longer side. But this is, again, these epidemics have come through human society regularly, usually once a century, and this is just the time that we're in, and this is how infectious diseases change society. Of course, we have elections coming up. As we said, if you look at our electoral politics on the federal level, we have people who are advanced in age. Come in. We have people who are advanced in age. I'm still doing my thing. We have politicians that are advanced in age and are potentially susceptible as well. So I have no guesstimation. Again, I've just been saying 3 to 6 months. Some people tell me that's too short. Other people tell me that's too long. There's no way of knowing at this point.
Can I jump in?
Sure.
So, Mike, hi, thank you for this. I've been reading almost everything coming through. And by the way, for station managers, I'm running a daily blog of a news consolidation blog that you might find helpful. But one thing I've been reading is that we can practice all this social isolation and we can start to flatten the curve. That's not sustainable because the economy has to keep moving. People have to earn money somehow. They are going to socialize, and they can't keep school systems closed forever. And that as soon as there's any relaxation of these restrictions, then we're going to see the numbers jump again.
So China is starting to relax their social quarantining or isolation. So it'll definitely be interesting to look at what the Chinese experience is going to be, because again, they just started. I think they allowed kids to start going back to school, and I think, and I know that they've lifted a lot of their quarantining and social isolation. So I hear you. Your point is obviously well taken. There's no answer for this because again, we're in unprecedented times and we've never seen anything like this. So I don't, I'm a public health practitioner. So I look at things from the public health perspective and let, kind of the stuff, regarding kind of economy and stuff like that, I leave that to the local leaders. All I can do is really focus on the medical and the public health perspective. But I think your point is very good.
Right.
We have another
one other question, which is, are we going to broach the subject of sexual transmission? Because it would seem like if it's 1 micron and I have to worry about the guy in the grocery store putting stuff on the shelves, should this conversation be had, or are we going to kind of assume it's folded into the larger discussion?
Did you say sexual transmission?
Mm-hmm. Yeah, meaning proximity, intimacy.
Yeah, I mean, I would imagine that sexual in the sense of, is it transmitted through kind of genital fluids? I don't think so. I think that if there's transmission, it would be through kind of close, intimate contact through, in the process of engaging in intimacy, kissing and hugging and being close to one another. This is transmitted through the air, right? If you're breathing the same air as somebody who's infected, you're likely to get infected yourself.
Right.
So
it's included. It's included in.
Yeah, I wouldn't refer to this as a sexual transmission like you would for like chlamydia or gonorrhea or syphilis, but I think that in the process of engaging in sexual intimacy, yes, it could be transmitted.
I have a question about the airborne nature of it. We are also trying to keep just one DJ in the studio at a time, but how long would the air become potentially dangerous when the next DJ comes in? Is that something we're really concerned about right now?
So, I mean, that's a good question. And there's really, for somebody, obviously, let's just be very clear. I didn't think to put it on that slide that I showed you. If somebody's sick, they shouldn't come. They shouldn't come, obviously. But for people who are asymptomatic, so the question that you're asking was actually answered in the last day or so. Is what's referred to as either fomites. So in the air, it's going to probably be in the air for 30 seconds, maybe a minute, and then it's going to deposit. It's going to land somewhere. When it lands somewhere, it depends on the material that it lands on. So plastic and I think cardboard can hold on to the virus for a little bit longer than other materials. And again, that study just came out like a day or two ago. And I haven't had a chance to really look and study it in detail, but what came from it was, again, those are called fomites, and fomites are the things that can give an infection. So let me give you the best example of a fomite that we're all aware of is the early settlers in the U.S., in America, gave blankets infected with smallpox to First Nations people, right? Those blankets are referred to as fomites. So that just gives you an idea of what a fomite is. So it's an object that can transmit virus. So that's why we're putting socks over the microphone, because people touch the microphone and can touch their face. And so is that a potential risk? It is, but we feel as though we're just trying to tell people to wipe down everything after they're done, and we feel that being on air is an essential service to our community, especially if people are going to be in quarantine for several months. We focus a lot on local New Orleans music and musicians. So we also want to give a venue for musicians to be able to do their stuff and continue our New Orleans culture. So I think your question is a good one, and I think every station just has to make that decision on their own. Last night our board met, and that was what we finally kind of came up with after a lot of discussion over the last couple of weeks.
And as far as the mic socks go, can you just spray those with a disinfectant to make them clean for the next DJ? Would that be effective?
So I'm told so I'm not a radio person, right? I knew nothing about when I started radio about WHIV 5 years ago, and people think that I still know nothing about radio, and that's a fair comment. But Bob Dunn, who's our SEC guy, who started WXDR at a local community college here, he's the guy that we turn to for all of our technical information, and he recommends not spraying the microphone with anything. And I'm sure that there's probably very, very smart people that are on this call that could talk to that better than I could ever.
I'm talking more about the mic covers, like the mic socks that go on the top of the mics. We've been trying to change those out for every DJ. And I've been bringing them home and washing them, but I'm wondering if spraying like a disinfectant spray.
Yeah, what we decided to do last night was tell DJs that they need to come with a clean, literally a clean sock, and then they go home and wash it. So this way, because when we saw this coming down the line, we try to order them online, and we try to go to a local, we have a Guitar Center about 25 or 30 minutes out of town, and they were already gone by the time we got there. And so just like everything else, we're just finding it hard to find supplies.
And if you have a DJ that has been out because they're experiencing coronavirus symptoms, how long should we plan to keep them away from the studio?
So 14 days minimum at least, and if they're still having fevers, at least a couple days after they have fevers, there's no real guidance. Usually we turn to the CDC for stuff like this, and the CDC has been somewhat muted, unfortunately, by the Vice President's office, and so kind of the most famous doctor right now in the U.S. is an infectious disease doctor. Of course, Dr. Anthony Fauci is the one that's able to talk on his own without being kind of muted by anybody. So I anticipate that as we start to see more and more cases being diagnosed, and we will because we're seeing more and more tests. You know, on today, Thursday the 19th, we've done 60,000 tests. At the beginning of the week, we'd only done like 11,000 tests. So we're going to start seeing more and more cases. What we're seeing now is just truly the tip of the iceberg. And I imagine those recommendations are going to start coming down the line very, very soon as people are starting to experience. In fact, I had a nurse just text me that same question about right before we got on air. She wanted to know her dad has COVID, and she's been quarantined for 10 days, but she's still having fevers. And she was asking me, she knows the hospital's going to come to me to ask what the thought is on that. And I'm going to have to go and kind of make sure that I understand that 100% correctly, because I'm not sure that we're just getting to that point where people are starting to reach 14 days. So there's no solid answer right now, I guess is what I'm saying. Just make sure they haven't had fever for a few days. Make sure they're asymptomatic. And right now, that 14 days is really important.
I have one further maybe statement and question, but here at WRFG, we were able to procure some mic covers and headphone covers that are disposable. And we use those. They're blue. I wish I had one here to show you. It's in the studio, but we have those, and we're using those as air shifters, as we call them, are coming in and out. They're just changing out. The one that's on takes off the one that's there, and put a new one on for every DJ or every air shifter is being able to use that. But I want to ask the doctor about this thing called herd immunity. Is that something that's being looked at or recommended, or probably a prospect that may happen in terms of trying to somewhat slow the tide of the spread or the contagion, herd immunity?
Yeah, that's not gonna be something that's gonna be effective right now.
I can't hear you. Ursula needs to mute your phone, Ursula.
That's not going to be something that is going to be effective right now, and that's largely because nobody has ever seen this virus before. So the herd immunity essentially it's great. For example, like if like let's say we're all vaccinated against measles, right? So the reason that I showed you that the R naught for measles it's like 9, right? It's the most highly infectious disease that we know. When you get something like 85 or 90% of the community that is vaccinated for measles, the R naught in that community becomes less than 1. So that means the 15% that aren't vaccinated are going to be protected because everybody else is vaccinated, and it drives that R naught to less than 1. So that means it's not going to spread. The virus has no place for it to go. So that works great in vaccinated communities. But we are all susceptible to this virus. Everybody is susceptible to this virus. Everybody, because this virus has never been in human beings before. In 3 or 4 years, when we have a COVID-22, for example, maybe there may be some herd immunity to COVID-19, but we've never seen something like this before, and so we are all going to be susceptible to it.
Hey, excuse me, Ursula, you need to mute your phone, mute your Zoom, Ursula. Ursula.
Juanique, yeah?
Yeah, you need to mute. You need to mute. We're hearing all your background noise. Yeah, thanks.
Mark, before I mute, can I ask you a question?
Of course.
Well, we have screens in front of our mics. Is it a good idea to tell our hosts to bring in, say, like maybe a handkerchief to put over the screen?
Sure.
Does that help?
I at this point, again, we're in unprecedented times, so this is new for all of us. But any barrier that could potentially, is it going to be perfect? No, because again, the virus is 0.1 micron, and it's very small. And again, to give that context, the thread of a human hair is 75 microns. So this is very, very small. But that being said, people who sit in front of a microphone talk, and so yes, the virus could potentially transmit through either aerosolized or through air. But if it's transmitted through droplets, maybe the handkerchief might catch some of that virus, and it'll remind somebody not to touch the microphone. But more importantly, when they take it off, and then somebody else puts another handkerchief on that, it's their own clean handkerchief. So maybe they're not going to be touching some of the previous remnants, on that microphone. So it's not a bad idea.
This is Jim Costello. The Shure Microphone Corporation recommends washing them with soap and water.
Washing the
microphone covers.
Oh, the microphone cover is great.
We're using pop screens as well, and what we're doing is just spraying them with the little spray bottle with 70% alcohol, saturating them after each use. What I was worried about is if the alcohol gets inside the microphone, does it damage the microphone?
I couldn't say for that.
I would take the cover off and then do it. Don't spray your microphone with alcohol. Take the cover off if you're going to use alcohol.
Well, we're not using covers. These are pop screens. They're pop screens. We're using teal mics, broadcast mics.
You mean a sponge type windscreen?
No, this is a
just
metal
a flat type.
Yeah, the flat
just
type.
That's a nylon sock essentially.
Well, no, it's metal actually. Anyway.
Maybe you want to cover it with something else.
Like this kind.
As the doctor said.
Yeah, that kind. Yeah, exactly. Like Kate sharing. That's what we have.
Yeah, that's a trap.
What we do with ours is we have every person that leaves has to wipe it off with sanitary, really strong alcohol content and the microphone, because even though it's behind there, obviously droplets could get on the microphone too. So our public health advisors have told us to do that.
Damage if we spray it with alcohol, it goes on the microphone.
No, we use the wipes.
Hey, this is Vanessa from Philly, and I have a concern because we are in Philly where everything is shut down for 2 weeks. It looks like because so many people are not social distancing that we're headed for a shelter-in-place scenario. So I'm wondering if folks from the Bay Area, if anybody's on this call, how that would potentially impact your ability to broadcast. And at this point, I made the decision to close the studio, mainly because I don't have a good way to ensure that everybody's disinfecting everything. Like, I can't even make sure that they hang up the microphones correctly. I really don't trust all of our programmers because there's over 80 of them. to do all the things that are necessary. Like when I'm in the studio, it takes me a good 15 to 20 minutes to properly disinfect everything. And I just can't imagine a scenario where every single person would do all of those things. I really don't think it's a good idea to spray your microphones with anything. That definitely damages it. It damages the board as well. So you have to use wipes, but there's so many surfaces beyond the microphone. There's like the door handles, the light switches, the everything that's in the studio, the chairs, the desks, the pens. I mean, there's an enormous amount of effort that is required to make sure everything is deep, clean, and disinfected. And on top of that, I really worry about our volunteers, most of whom are over the age of 50. Like we have a really good amount of people over the age of 65 who really should be staying home. And I don't really want them to go out. And I hate to say this, I don't trust that people who are sick to stay home, because I've seen people come in sick for the last 3 years. And I'm like, why are you here? You obviously have a cold or you don't feel good. And so I just want to know like how people are regulating that. How do you supervise that? Where's the accountability? Because I'm having a really hard time with that. And for that reason, we just shut the station down.
This is Katia. It sounds like I'm from WPFW, one of the Pacifica stations in DC, and we have a very similar scenario. We have over 80 volunteer programmers. And so we kind of have closed off our talk studio now. So all of our public affairs programmers, which is really, I like to think the bulk of our programmers, they are doing their shows by phone now. No one is allowed to come into the studio. Whether you're a music programmer or public affairs programmer, no one has guests in the studio. We have only one engineer at a time on, I think as Dr. Dery, did I say your name correctly? Specified. So we have an engineer for the morning, and then there's like a literally an hour in between shift change because we have a music program there, and then we have one person in the afternoon. We have suspended using logs so that people don't have to touch pens or write anything in the studio. We just don't even have them out. I mean, honestly, nothing is there for them to touch. Most programmers, a lot of them now use their laptops, so it's not disinfecting all of the CD players or the LPs or the turntables, which we have 2 of. It's more like the aux cable, the mics, the board, those kinds of things. And we also have alcohol in there. We have been spraying actually our windscreens with alcohol, and we have a protocol that each programmer has to follow. We have a camera in our studio. So on the one hand, we only have music programmers doing this, and our music programmers, we have about 3 each day and 1 during the day. So we have music overnight starting at like 8 p.m. and we go to 8 a.m. But in that span there would be 4 people in there. And, there is a bit of trust in relying that the music programmers who are still doing shows are doing following the protocol and cleaning up the studio. But I mean, I don't know if you have this option. If you can, say, okay, the music programmers for obvious reasons need to come in, but those that have collectives, it's only one person from your collective now that can be in studio doing the show. It can't be the whole crew. We have that with we have a few hip hop programs where they had a number of DJs that would work together, but now it's only one person per show in the studio at a time. And as I said, all of our public affairs programs, which run from like 8 a.m. until 8 p.m. All of those programmers, which is about 8 in a day, are to do the show from home, if that helps you any.
Vanessa, we've been,
thank you.
Sorry, go ahead, Vanessa.
No, I was saying, that is helpful. And I guess as a follow-up question, this is for the doctor, and I guess you could answer after Sharon makes her comment. What should we do if somebody is in the studio and we find out later that they have COVID-19? What should we completely shut down for another 2 weeks? What does that scenario look like?
I mean, that's a great question, and it's again, it's hard to say. I mean, we know again that the virus can live on surfaces for a couple of days. I'm not sure you need to shut it down. The 14 days is coming from the incubation period. So it's really, we look at that for humans to determine how long it's going to take for them to determine whether or not they're sick or not, or whether they express the illness. But, you know, it may be wise to shut it down for a couple of days. That's probably not a bad idea. Again, we're in unprecedented kind of uncharted territories here. So if somebody was asymptomatic and then they develop illness and they were in the studio, again, it's impossible to say how to proceed, but it's probably wise to probably shut it down for a day or two and just, you know, operate remotely.
You also have to think, Vanessa, about the people that have been around that individual. And because I've seen, just like you, people come into the studio sick throughout the year, and then next I see the DJ after them get sick and the DJ after them get sick, and it kind of passes like that. So we had someone that was concerned they had symptoms. He came in at 6 p.m. on a Tuesday. And then, so we had everybody that came in after him on that day take the next 2 weeks off as a precaution. And we are very strict about people not coming into the studio with any kind of symptoms, be it allergies or colds or hangovers or whatever. If they're not feeling well, they are not to come to the studio. And if they do, they will lose their show. We're being very strict about that. And reminding them every single day. And if I see a DJ post something, you know, that they're having allergies or whatever on social media, I'll call them and remind them that they can't come to the studio for, you know, until 2 weeks after those symptoms have gone away. I'm being like overly protective about that. We have a lot of the same things that these other stations are doing. We're really trying to stay on air. But it is, you know, it is concerning. Obviously, the health of our DJs is the most important thing. But I did want to say that I talked to Jennifer Waits at KFJC. They're under the lockdown in San Francisco. And apparently, as we all know, radio is an essential service. So the radio stations are not being told to shut down when other businesses are.
Otis, I have a question. How many stations are working on the ability to do your show from home? NPR. I know that Katia's working on it at PFW.
We're doing it in Philly, and we're developing some materials that we can share with everybody in the network. We're developing a video on how to use StreamYard, which is a really great free software that you can use to do your shows. It also has like a video streaming element to it. And Allison, who's on the call, has developed a video on how to record a show using Audacity. One of our other staff is working on a video and tutorial on how to use Anchor FM. So because we're shut down, that's what we're spending our time doing, is teaching people how to make content from home. And we're happy to share all those materials with everybody else for y'all to use as well.
Yeah, there's some very simple tools. Like
Katia
is saying she's having trouble with but it's a pretty simple tool. And John and I, you know, John Elmel and I are certainly available. You can reach us, you know, through URSWIV if you want help.
Yeah, we also at 89.3, well, WRFG, and looking at, we have some of our committee of the operations, some of our young techies are looking into how we can do it successfully from home. I would like to get, what you said, with that StreamYard, STRING, Yard?
I'm gonna type it in the chat. It's called Stream, like live, like
Stream. Okay.
Yeah, StreamYard.
Yeah, we have a couple of options too that we're looking at. We have a meeting tonight as well to talk about some of these facets. We have over 100 people on the air. Airshifters on the air, and that's, you know, and they're following each other. It's all consistent, you know. So we are trying to see how we can work out maybe even some of the public affairs ideas of doing those from home, and then working on how to get the music up and running to keep our airways filled. So this is good information.
We're also putting people on the air using Zoom, so people can see each other. So it makes like a virtual studio, and we're just doing a Zoom call and then putting it on the air, you know, sticking it into the console.
We've had good luck with AzuraCast. We're just starting that. We just set that up. and it seems great. Garrett Kelly at KHUH helped me set that up. And you guys can find him if you're on the LPFM Solidarity page. There's a little chat about that. But AzuraCast, it seems great. It allows you to plug in, DJs can plug in their own mixer from home and their own microphones, or they can upload a playlist directly into the program. We haven't actually tried it with the DJs yet, but I tried it at home and it seems to work great. So
Sharon, how are you spelling that? Spell that for us.
AZURACAST.
You put it in the chat as well?
Sure.
We're running out of time a little bit, so I just want to make sure that Kate Ingram has a chance to present before she has to go. We'll give the floor to you, Kate.
All right, thank you. Yeah, it's kind of busy here in Little Port Townsend, but I will say that it makes us all feel connected. We're sort of using a little motto, radio connects us all. And one thing that we've started doing is to have sound, like little IDs that are exchanged with other community stations that we're putting on the air and sending them out to other stations to just say, you know, hi. We say hi from Port Townsend. We've sent them to Josie and Moab and some other stations, and they're, I don't know, it just seems to bring, we're trying to keep the messaging very positive for, there's so much concern and fear, as you well know, out there. We have a population that is at least 35% over the age of 65. We have 4 cases in Port Townsend that have, supposedly the contamination came from visits to Seattle. So we haven't had any local ones as of yesterday's results for the testing. But then, like most places, there's been very little testing so far. I guess the main thing that we're trying to do is to follow the advice of the public health advisors that we have. We have 2 people on our staff who are long experienced public health professionals who are now retired and have time to do this. One of them is an RN who worked at UW in Ebola, and then another one in San Diego with tuberculosis for many years. So I've really relied on their advice, which has been important because a number of our staff are really concerned that they're going to come to the station to do their show and get the virus if we don't kick everybody out. And we've gotten some good practical understanding from them. So if you have someone, the other thing that I'll add, because this came up a few minutes ago, is that what we were told is that if someone does contract COVID from our staff who has been in the station, and we have locked out the public and only essential people are here, but we're not a station that's equipped to go automated, or at present we haven't yet got the video capability that may come. But what we are doing is what we're told would happen is that they would investigate the length of the exposure and such as that to determine whether there needs to be a lockdown, or if we have to get Servpro in to come clean or do something, but with the idea that radio, as someone else mentioned, is very essential. And especially in a place like this where we don't have any other local media except for our daily and weekly newspaper, which can't do what we can do. We also have a very large population of people who are involved in nonprofits. So that has been something that we've had to pivot on, doing our community calendar. And instead of the calendars, we're now airing what we're calling community resources listings, and we're asking people to send in if they have something to share. For example, when Governor Inslee said that all the restaurants had to close, a lot of restaurants had a lot of food to offload, and here's another dilemma that we've just recently faced, is that now there are some restaurants that are allowed to do pick up and take out food, but with the restriction of being a non-commercial station, we can't say, and it would be a promo for us to say so-and-so restaurant that's for-profit has food to pick up and go without it being underwriting. And for God's sake, we're not going to be asking those hard-hit businesses who've had to lay off, you know, dozens and dozens of employees in our small little economy to buy underwriting right now. So we're reaching out to other avenues to try to get underwriting money so that we can air announcements and let people know what businesses are available that can, you know, what ones have that gives them informational types of underwriting spots. Has anybody else had that kind of situation?
See if we should find out about that in general, Ursula, because I don't think that you're running into a problem by just giving information.
Well,
the problem is when you do an inducement of some kind.
Well, my understanding is that, you know, there's been some crackdowns lately about underwriting, and what that can do is that anything that promotes a business that is for profit is considered to be an advertisement, and we're not allowed to do advertising. So we're trying to play it kind of clean.
Yeah, that's
my understanding is that if they pay you to say it, it is advertising, but if they're not paying you, information. That's my understanding, but I guess I have to work with our lawyer again.
Yeah, my understanding is if you're doing a list, like for example, if you say this is all the places in the city where you can get, you know, free lunch, or, you know, there's food distribution happening, and you give a list, that's public information. And not like, that's not a promo. And we do that with events, right? Like we list like free concerts and things happening in the city as part of a community calendar.
Maybe she'll, are you muted?
If they pay you to say it, then it's advertising.
Yeah, I would also tell people that there is a list available on your website, or to follow you on social media for the complete list. If you're really nervous about it, just drive them to another platform where you could post the full list.
Yes, and that does seem to be one of the, you know, ways that we can play it safe, both with the list and with the, but still there are other people who can buy underwriting, and as long as it isn't call to action, it's not an advertisement unless it gives an incentive or something like that. So those are the criteria that we've implemented so far. We'll see how it evolves, but these are all kind of new things that I'm sure all of the stations here on this meeting are doing. One thing that seems kind of ironic to us is that we have had, ever since this station first began in 2011, we've had a very active emergency team, and we have a station staff person on call every month to rotate, to be available to deploy if there were an emergency. And of course, the emergencies that we've drilled for have been tsunami and earthquake and fire. And quite frankly, we really have not thought too much about a contagion. So late in the month of February, when we saw that the virus was going to become a thing, or had become a thing, we enacted our virus watch team, and several, including the public health professionals I mentioned, and other people, DJs and hosts from our news people, came together, and we've been looking, and that's been the lead. This group has been the lead at KPTZ for how we're dealing with the virus and how we're messaging about it.
Can I?
Notes on
I want to quickly interject something, if I may. I know we're in this emergent situation, and it may well be something that the FCC may later allow for certain types of intercommunications. But I know for certain that you cannot induce anybody, or even we can't even say free. That's an inducement as well. So you have to be real careful of what you're calling the action. We have a rule here at WRSG that you don't tell people what to do, regardless of what you're saying. That if it's not telling them what to do, like call, contact, invite, that kind of thing. But we have to, of course, we're playing it by ear, and we have to be real careful. But and people are not buying; they're really donating to us. They're not buying advertisement. They're donating, to us, for discretionary mentions on shows they support. So we have to be clear about the language. I don't want us to get caught in a bind, because we are thinking that because of the emergency situation we can get away with certain things, or because that, and unless we are giving instructions that come down the pike that says all bets are off, go for it, whatever the case may be, to save lives. And I think that we have to be real careful from a operations position. That we have to be careful about what we say on the air and how we tell people what to do relative to the airwaves. So I guess we can look further into it if anything's coming down the pipe from the FCC around that, but being real careful around telling people where restaurants are, to go to these restaurants, or even to mention them. Mentioning them is one thing, because all you're doing is giving information and facts, but telling people what to do and how to go about getting stuff is another.
Yeah, thanks.
John says that you can create a place on your website with a list of restaurants and resources for the community and plug that resource page on the air. And Leo says if you announce informationally all the businesses that have takeout, that is not a call to action.
Yes. And that's what we're doing. I think it's something that, will probably go on afterwards in a way, to help be more supported to the network of the community. The other thing that I will talk about before I step down is KPTZ, like many of you probably, we have a very active remote crew, and our remotes are usually concerts. There won't be too many of those happening, but what we have started to do is to broadcast the live county commissioners meetings where our public health officer and the emergency department manager are speaking and giving people updates. And we have so maxed out our streams. We have one coming up today at 5. And so I think having that, even and then being able to stream it afterwards if people missed it, has been very comforting to people who otherwise are watching the national news and literally getting freaked out by just the continuous change and stressful information. We're trying to be a balance for that.
Okay, very good. I'll alter the schedule, the community calendar for that.
Does anyone else have anything they want to add? We were hoping to hear from Celeste. Are you here, Celeste? Maybe not.
Well,
Okay.
I have a question, Stephanie. I just want to know, will all of this great information live somewhere where we can return to it?
Yes. I'm going to post it up on the Pacifica Network page. We have a page for roundtable talks, and I'll remind everyone when I get it uploaded on the station manager's email.
All right. Well, thank you, everyone. I'm going to probably sign off and come back into the recording, but it's nice to be with you all.
Thank you, Kate. Thank you so much. And thanks to Dr. Dery. He had to leave. He has patients he had to see. So he says thank you and goodbye to everyone.
Can you also give us his information? Is that possible?
Yes, I can do that. Here, I'm going to type his, he asked me to type his, he has an email here if anyone wants to talk to him.
While you do that, I wanted to let you all know that PSAs on this have been relatively hard to find. So we went ahead and drafted some of our own, and we've posted them on our website for you all to use. You might have to change, certain things. Some are site specific, but others are more general. And we posted those on our website, which I typed over there, but it's artxfm.com COVID PSAs, and PSA is
Sharon, would you be willing to post some of the more general ones in audio port under PSAs?
Sure, but right now these are just, we can do that, but we'd have to get them recorded. Right now these are just typewritten.
It's text, okay.
But I could try to do that.
Well, we'll record some then.
Okay, yeah, please do. And then
Okay.
I just want to say also, we did put in audio port a Spanish language. It's a 15-minute, very informational piece with a couple of doctors. Our DJ Luis de Leon did it. It's fabulous. It's really interesting to listen to. And we posted that in audio port. It's in the Spanish language section. You can also find it by searching art.
What's it called, Sharon?
It's kind of got a long name and it's in Spanish, but if you go to the Spanish language section of audio port, you can find it there, or you can search ArtXFM and it will come up.
All right, thanks.
Sure.
And you guys can check the chat. It looks like Vanessa put up a PSA link there. And I also put Dr. Dery's email on there. Can everyone see that? And let's see. I'll email that to everyone too as a secondary thing. And yeah, what else? Oh, I saw someone ask for a URL for he listed a website, was it?
Of the coronavirus.
I'll find out what that is and get that to everybody too.
Can we search, what is it, WHIV FM? Is that his station? Is that right?
Yes, that WHIV, that's right.
WHIV, okay.
Yeah, in New Orleans.
Yeah.
I'll also say quickly that it's also time for the census. I know it's like kind of crazy, but we got a grant to produce a number of census videos in a lot of different languages. And so if folks want to run PSAs, you just, again, go to our YouTube page at PhillyCam. That's CAM, and all the videos are on there. It's pretty easy to convert to MP3. But while people are home, they might as well be completing the census too.
Why not? And also a reminder that if Dr. Dery has a show with Sprouts, you can check out. We have it on SoundCloud at Pacifica and audio port, obviously. Let's see what other people. James Costello says NAB has some PSAs that are recorded. Oh, you talked about the Spanish program. Okay. Someone else said, does anyone else have a college or community radio station, community college station? All of our students have been sent home for the remainder of the year. I don't think we have any other college radios here. Okay. Does anyone else have anything they want to add before we go?
Yeah, just one more question. I imagine we'll know from the station manager's site whether or not we're going to have another meeting if it progresses or something else happens, or if it digresses, I guess. You know, if it gets worse, well, I guess we can revisit and come back and get some updates on where we are as we continue to monitor the reports coming from mainstream or coming from the government.
That's a good idea.
Yeah, I'm kind of sorry, Stephanie. Didn't mean to step up.
You can go ahead. I was just maybe should we just say the next meeting will just be a follow-up?
Yeah, I'd like to. I test the waters with the rest of you about whether you know, we have a lot of questions here about how to market the station and fundraise. And, you know, kind of the interface between a mission, you know, serving our mission, which is really service. Meanwhile, branding the station as a service that people want to support and actual fundraising. This comes at a time when we would normally be doing our fundraising. We had to cancel our fundraising event, and just how people are coping with the fundraising aspect of, you know, in this new climate. And I'm wondering, is this something that we could spend some time on in the next call? If you like.
Great idea.
Yeah. Anybody else raise your thumb if you think it's a good idea?
Yes.
Okay.
Excellent idea.
Sounds good. Does anyone have a feeling that they could take the lead on that, or that they have ideas already going in those directions? Not yet. Okay.
Not all at once, please.
Yeah, you know, another thing that we're kind of struggling with to get clarity on as quickly as possible is who exactly in the community we should be, you know, partnering with in terms of, you know, information and, you know, what the most important parts of our community are to just kind of keep in touch with on a regular basis. And you know, I would be curious in a month to hear from the rest of you what you found, you know, turned out to be the best strategy in terms of your priorities of what to put on the air. It's you know, we're trying to figure that out, you know, in real time right now.
Ursula, I just want to say that one of the things we're doing, and we're happy to post it if it seems relevant, I can send it to you and you can let me know, but we have a social justice calendar that we do in conjunction with the Institute for Policy Studies. We've been doing it for several years now, but we're changing that calendar to a social justice resource calendar. So it'll list, for instance, organizations that are raising money for particular segments of our population hard hit economically by this, or you know, there's like the prison abolishment movement, for instance. They're doing a whole lot to see how prisoners are affected around COVID-19 or any. So anyway, the calendar will list both national, I guess for us it would list local and regional as well, but I could talk to them and maybe they would do a national version that I could share with this group if anyone's interested in running it. It usually ends up being like 2 minutes or so, and you would need to edit it as things become old. But because this is a resource calendar, not an event calendar, I would think most things would stay relevant. So I'm happy to share that with you if you're interested.
Yeah.
I've been doing a daily news briefing. We basically have to watch a lot of press conferences. Luckily, they're streaming everything. So we watched the city of Philadelphia's press conference, the state press conference from Pennsylvania and New Jersey, because our signal reaches into a good chunk of Camden County. And, you know, whatever we could stomach of the Trump press conferences. And it's about half hour long with all the resources. So what we try to do is give a daily update on the number of cases, the testing situation, any new guidelines that the Department of Public Health is issuing, updates on the school district, what's happening with the recreation centers, the libraries, city's essential services, and then listing resources and what small businesses can do, scholarships, fundraisers that are available, and any other PSAs that people send us. I'm part of a Facebook group in Philly that's called like Abolish COVID-19 Philly. And it's really a lot of organizers and activists and healthcare professionals. And the group is really listing all kinds of GoFundMes, free food, childcare. And so that's something that I mind for content as well. So I would poke around and see locally where people are listing that information. And I also put announcements on those groups like, hey, send me anything that you want to announce on my daily newscast. So people have pinged me with flyers and other information. So it's really easy to do from home, like I said, because so much of that stuff is live streamed. And just, you know, make sure you're signed up for the Department of Public Health or the city press releases. And you can mine a lot of the information from there. And that's like doing that, like, you know, I mean, I do have a journalism background, but, you know, I'm a station manager. I don't usually produce a daily news show. So I'm just doing the best I can to make sure that that information goes out. And I also Facebook live stream it when I do it. So not only does it go out on the radio, but it's going out on social media as well.
Thank you, Vanessa. Thank you guys for all that. That's a lot of good information. Is there any more comments or questions? Okay. Well, maybe we'll leave it for here now. And then we'll just plan to do a follow-up next month for the same topic. I think that's a good idea, and focus on what Ursula was saying about fundraising and et cetera, and how we can be of service. And I think we got a good start with what you were just talking about. And oh, Dr. Dery says thank you and goodbye. He had patients he had to go take care of. And well, I'll have the video uploaded shortly, within a day. And everyone, take care of yourselves.
And thank you, everybody, for showing up. It's really heartening to see you.
Thank you.
Thank
Be
you all
safe.
for putting it together.
Thank you.
Yeah, thank you for hosting.
Thank you
so much.
Be safe, everybody.
Stay safe.
Bye.
Thanks a lot.
Oh, yeah.
Bye-bye.
Bye now.
Yeah.